thanks everybody for showing up and for your support. So as Suzanne mentioned, I'm a California licensed midwife through the Medical Board of California. And today I'm going to be talking about midwives as primary care providers as part of a solution to our healthcare system. So that's my presentation. Many of you already know that midwives attend women during their pregnancies, during births, and also the immediate postpartum through the first several weeks. So that is a big part of the work that I do. We also work with families in other capacities, and we also see folks at different stages of their lives. So one of the sayings, there's different sayings for midwifery, but I can start off with the definition of what a midwife means. This is in English. So midwife comes from Middle German, and it means with woman, midwife, with woman. That is the true definition. So if anything can be taken away from that, is that it really is someone who supports choices for half the world's population. And when I first began learning about midwifery, it was not a topic that was very recognized. Midwifery has had a long history, and there's been a lot of waves to try to actually get rid of midwifery through different times, and it's made a resurgence, and we are back, and we are part of the healthcare system. We want to be recognized in the same way that midwives are recognized in Canada and in the UK, where they're part of the healthcare system. Right now, because of the way we're set up, there's a lot of insurance involvement, and I'll just keep it really brief that it makes things a little bit more difficult for independent midwives. There's a different structure system. There's no reason why under our licensure we can't be a much more integrated part of the system. And so today I'm here to talk about potential solutions and ways that midwives can be of service beyond the childbearing cycle. Because I think a lot of people, they come to me and they're like, well, I don't need a midwife, because I'm actually not having babies, or I'm done having babies, or I never want to have children. And I often will remind people that we do primary care as well. So this involves your reproductive health, doing women histories, doing physical assessment for especially women. Some people, I'm not specialized with men's health care, but I do work with men as part of a family group, is really the way I see it. Also working, within different stages of the life, of your life, from menarche through menopause and beyond. So menarche is when you first get your first cycle. It's a very special time. There's often some kind of a ritual or some kind of remembrance, and we're bringing that back as well. We want historic recognition of that time of bearing, potentially being able to bear children, and it's a very fertile time. But we continue, and then we also reach our later years where that changes for us, and we no longer put energy out every month into that. And I myself haven't reached those years, but I do hear they're very good. They can be very rich years. So midwives can actually work with families or with women, especially throughout different stages. And as primary care providers, we can order lab work that is within the scope of women's health. So for example, I will go ahead and meet with a client. She'll say, hey, I have a couple things going on. I want to come in. Maybe she wants a pap smear, a clinical breast exam, and she wants some lab work. So when we first meet, we do a little bit of an assessment and history taking to find out what she's needing. Because maybe she's here because her period's late. She might have already taken a home pregnancy test that was negative. There's a lot of factors involved. So we spend some time getting to know her needs, and we work with what her interests are. And that being said, using her cultural values, the things that she would like to have in her care, rather than me saying, okay, we're going to do X, Y, and Z. It's really much more personal care that involves putting the person in the center of their health care and explaining the choices available, including the risks and the benefits, as well as not doing anything. And then really ultimately that decision falls on that person. So this model, so what I'm talking about is the midwifery model of care. The big hallmark of it is informed consent. And so this is really something midwives pride ourselves on. It's something healthcare really tries to uphold. It's not something that all facets of healthcare have. Childbirth has very little informed consent. Women's health actually is not taken very seriously. And so this is one of the reasons I really bring these talks is I don't think it's enough to only talk about women's health when it comes to reproductive health. Women have different needs. Our hormones are different. Our brains are different. Our expression of who we are, the diseases we may be prone to are different. And I just wanted to honor that and recognize that for us as half the world's population. Because a lot of times women will go and see a provider and actually not be heard or seen. So I just wanted to say that, it hurts my heart to hear that is still happening. It's been happening for a long time, for many generations, and even with the younger generations, it's still happening. I'm hearing that the newer generations of doctors are a lot more, they spend more time history taking and more time actually getting to know the needs of the person and focusing the care on them. But I'm hearing a lot of women especially still having negative experiences, such as maybe not being believed about being in pain for different reasons. Also maybe being mistreated for things that they're going through because of their physiology or the way their bodies are made, actually being put on psychotropic medication, being misdiagnosed and mistreated in the healthcare system. The cornerstone midwifery being informed consent, we really don't know what is best for everybody. There could be, I guess I'm not coming up with the best example, but for example, if let's say a woman finds a lump in her breast and she's like, oh my goodness, this is new to me, I'm concerned about it. Oftentimes I will get a call like that, will you please see me and will you please do a clinical breast exam? Sometimes those folks have already been seen in a clinical setting and their concerns were dismissed, but I'll actually spend time. I actually don't want to rush through that appointment, so I'll spend a good 20 to 30 minutes just doing a breast exam with her and explaining all the different options. If there is something concerning that we find, I go ahead and refer her to higher level of care, whatever that may be, and I also follow up with her, if that makes sense. So there's a lot more continuity of care and a lot more just care in general, a lot more concern for people's well-being. And I believe that it's the relationship, the ability to actually check in with each other, and how are you doing, and how, is everything going well for you, more than the actual degree you carry or even your expertise that actually helps people on their healing path. And I think it's when we're truly seen and witnessed, and when we're fully believed in the experience that is our experience, that we can actually move forward with our healing. So that's really what midwifery offers. And in our healthcare system, there's a lot of need for things like informed consent and continuity of care. So imagine if you saw the same provider growing up, the same person, and they would still be seeing you right now, however old you are, and maybe all the way through to your elder years. This is what we used to have, and this is what midwives provide. We provide this lifelong continuity of care. We are no longer having that, if that makes sense, right? Everyone's like, has anybody only gone to one provider their whole life? No, right? It's very rare. And also, it's because we don't live in the same area. Even this area attracts different providers. It's actually very difficult to retain providers here because we're so rural and there's different issues. So I just wanted to paint the picture of what midwifery can do. And midwives actually don't make decisions for you or for other people. We just inform you and give you the course of care or options that are available. It works because people take more responsibility for their own health care. So in our current system, and I think this really does need to change, there is this a patient, or I guess not system, you're a patient, and there's the provider or the doctor. You're already going in like a power imbalance because they're the expert and you're there with some kind of physical or emotional complaint. So you're coming in an uneven playing field, and then on top of that, there's time restrictions, and then there's hospital policies. So they might only have like 5 or 10 minutes with you in the room, and during that time they have to figure out what's going on and what lab tests to order. Midwives usually spend a good 45 minutes to an hour per visit, so it really allows that time to develop, to really look at your needs. It's really difficult to, I don't know if any of you, I myself have had this experience, have ever gone in for like a pap smear and had it be like so short and so like, I one time had a pap smear where the midwife or the nurse, whoever, the nurse practitioner, she was running out of the room as she's saying, "Do you have any more questions?" Close the door. There's no way, right? There's no way to actually like, yes, I do, but you're going to be in another room with another patient. So the time that midwives are able to give actually is, helps. It's like a preventative thing because it helps people realize like, oh, we can actually talk about your nutrition. We could talk about what your lifestyle is. We could talk about your psychosocial needs, such as, are you in a safe situation? Are you having a troubled home life? Like other factors that affect your health that aren't just, oh, well, your lab values are normal, so everything's good. Because as women, we have more complex needs. And a lot of women are not given proper treatment, proper diagnosis, are actually overdiagnosed for certain things and underdiagnosed for other things. And then on top of that, you add things like socioeconomic status, whether or not you have private or public insurance, as well as your cultural background. There's a lot of layers to healthcare that make accessing healthcare and getting the proper care really difficult. So the idea of having more midwives integrated in our healthcare system could be a really awesome ground. You can train as a direct entry midwife in 3 to 5 years, and technically, even though, depending on the state law, like in California, we are considered independent providers. We don't have to have a physician supervising us. It's nice to have other providers to consult with. And we're very lucky in this area that there are a lot of more holistic providers that also, like for example, if one of my clients has a medical issue or a medical need, I can call some of the providers in the area to try to get her seen right away. And if need be, of course, send her to the hospital. But it's a really beautiful area we live in. I think the much more smaller community feel makes it more accessible in some ways. I know there's a lot of people that aren't coming in to be seen, but I myself, I do work with teenagers. I work with, I see women all the way through. I actually did a pap smear on a woman who had already completed her menopause. She actually didn't even need one, but she wanted one. And I saw her and her daughter and did her full assessment, her physical and everything. And at the end, she was like, "I think that was like the best pap smear ever." And she was so happy, because a lot of times women actually have traumatic experiences in those situations, especially when you're being rushed. Things aren't explained to you, and then there's like the whole stir-up experience. So even in my practice, like I work a lot with like tuning in, and like I mentioned with informed consent, like I will not touch someone without letting them know what is going to happen ahead of time. And even with like the speculums, for example, for a pap smear or to do some kind of testing, sometimes you need a speculum. I often will have the person insert it herself. And a lot of that, like something like, 1 in 3 women have had a history of sexual trauma, and then also a lot of women have had obstetrical trauma. So one of the things I really want to work with is to have the experience of going to a healthcare provider be healing, not traumatic. And I've actually had women like cry about how it felt and say that it didn't hurt. Like people are surprised that when you actually do it that way, it doesn't have to hurt to put in a speculum. You can actually, see your own cervix. I often will show a mirror so you could look at it. And we do it together, so we work together on all of those things. So right now, we have a situation where we don't really have enough providers, like especially in rural areas. Like we live in one of the more rural areas in California, and oftentimes there's a lack of providers. There are a lot of options as far as putting midwives in different areas, and one idea I've had, and I think we could work something out, is to have midwives come to different communities. For example, spend one day in Covelo, another day on the coast, another day in Lake County. We're kind of already doing that, like Care for Her, the hospital-based practice, already has, they have a Willits location, they have a Ukiah location, and they have a Lake County location, but it's really hard to get in, and it's very impacted. Like, I've heard of women having to wait like a month to 2 months just for an appointment, which if you have a gynecological need is a long time. So I'm available also for stuff like that. For example, I've seen people, within a day or two for different kinds of infections, and like down there, when I say infection, I'm talking about vaginal. So we can get you assessed and we get you onto the treatment plan more quickly rather than, you don't want to suffer and wait for so long, if that makes sense. I work mostly with natural remedies. Under my license, I'm not allowed to diagnose or to prescribe. So, like, I can't prescribe antibiotics, but I can refer you to someone who can if you needed them. And there's also a lot of natural things you can do depending on the situation and what you're looking at. So that's a little bit about the midwifery model of care and how it can help improve our health care. The other aspect that I'm not even mentioning is it's a lot more cost effective. So not only do you get way better care and way more time, it costs like a quarter of what, an OB, or even less than what an OB would be. And you don't really need an OB unless it's like something that's more specialized. If you have to have surgery or you have to have something that's beyond the scope of like a regular well-woman care, then going to an OB is a good idea. But even with things like fertility issues, midwives can actually help with things like that. So I mention that because nowadays there's a lot of people that are suffering from hormonal imbalances. There's different things that people have going on, and sometimes they've tried going to different providers, and just coming in and meeting with a midwife would give them a better idea of what might be happening, because we're looking at not just one aspect but the whole person and their situation. So like I've helped people get pregnant who like tried for like 12 years and tried fertility treatments and things like that. And with other aspects too, women are also, like I mentioned, sometimes women are undertreated and sometimes they're overtreated. So right now we're being overtreated for breast cancer. The cause is not being explored. All those little pink ribbons, they're actually just marketing ploys. They're not really helping to reduce the rate of breast cancer. Breast cancer is a current condition or a current disease because of many factors. But one thing to understand is how our endocrine system works and how our bodies naturally detoxify. So everything actually detoxifies through the breasts. So they are like canaries in the coal mine for everything that's going on environmentally, hormonally, all of those facets. Right now, women are being overdiagnosed for breast cancer and having many interventions done, including having full mastectomies. That's where you have your breasts cut off, which is okay. That in and of itself will not actually save your life sometimes. I just want it to be really clear, because our endocrine system is really, really complex. So sometimes women are being overtreated that way. also the same with cervical things. In my generation, part of the reason I think so many of the women in my generation have had cesareans is because so many of our cervixes have been scarred. And that has to do with gynecological practices of looking for things and taking a bite, like a bite out of your cervix, which is part of your uterus. So we're actually creating problems that could actually affect her future fertility as well as many other facets by over-treating certain things and then under-treating other things. So I just wanted to kind of mention that because I do believe we need more healthcare providers that actually represent the population that they serve. I believe we need more providers who are from the communities that they serve and that are listening to their constituents or their clientele, and not just following along with what they learned in medical school or in nursing school, but actually looking at the needs. So, for example, this area is really rural and people are really super isolated. So one of the ideas I had was to come to them, and I do that as a home birth midwife. I travel around. But one appointment can take, many hours. Just to go to the coast ends up being a 6-hour experience to see one or two people. So the idea of having more mobility and having the ability to come, and let's say today we're going to be in Covelo and we're going to be doing blood pressure screenings, pre-diabetic screenings, as well as if people need any metabolic panels or any blood work, we can also, do prenatal care as part of that. We can also do postpartum care as part of that, and well women care as well. So there's already models for mobile clinics that go to rural communities, and I actually maybe even Covelo has one. I know Anderson Valley Health Center has some kind of clinic that is mobile. We have also talked with the Mendocino County Herb Guild, future, not current, but that's another idea, is to actually bring the plant medicine to people and how maybe there would be a midwife on site. We're really exploring ideas. Some of the problems, I don't want to say problems, some of the obstacles we're facing have to do with insurance and malpractice insurance. I know that sounds silly, but that's what regulates a lot of what can happen. So I just want to put it out there, the layers that exist within our system. So that is usually one of the things that people ask me about. In fact, when I share that I'm a midwife and I do home births, the first thing people want to know is, what malpractice insurance do you carry? And it's, what I want to say about that is, I do think that there needs to come a time where we take insurance out of the equation. I know that time is not now, but this time needs to happen sooner than later. I believe that sometimes all this risk assessment can actually make our society less safe, because we're spending all this time talking about all these risks while people are actually dying or being really unhealthy. So the U.S., as a comparison, the last time I checked, and this is probably a 2018 figure, it might be over a year old, it might be 2017, the U.S. spent $3.2 trillion on healthcare annually, which is what half of the rest of the world combined. So we spend as much as the rest of the world combined on healthcare does, just in one country. Every other country pretty much has socialized medicine. We also don't have the best outcomes. For example, my field being midwifery, the outcomes for maternal and child health, we're 70th in the world. We spend the most money, but we actually come pretty low. So that means we lose a lot of moms and babies. And we lose even more moms when they're Hispanic, African American, Native American. And so there's a big problem in our healthcare system. I don't believe that's going to change without us actually training more providers of color in those communities. And there's a lot of research that demonstrates that people feel most comfortable when they speak to someone that comes from their background, or it looks like them, or at least understands their culture. So I just wanted to paint that picture of what is possible. I do believe in my generation we are going to have to face those healthcare choices, and I hope that they happen sooner than later. So I just wanted to, if anybody had specific questions about the types of lab work or the types of care that midwives can do beyond childbirth, we could talk about, is there like any specific issue that we feel is really important to us as women right now as far as our health that we could, I wanted to maybe talk about one aspect like that. Is that okay? Since we have time.
I don't know if I should directly call out the clinic, but I've had issues where almost any birth control I've ever tried makes me really sick, makes my hair fall out, makes everything you can imagine happen, and I would constantly get infections. And every time I would go to this clinic we have in town, they wouldn't even fully look, and they'd be like, oh, you're fine, you just have a yeast infection, go take some medicine. And finally, one day, someone was like, I talked to Lydia, and I'd taken every single medication possible because I had every issue possible, and she finally was like, oh, well, I can't prescribe you these, but you should go get oregano oil and boric acid and use that. And so it's been better, but it's at the point where I feel like if there is something wrong, they don't care enough to look. If I have actual problems, they don't know, and they're never gonna know. They don't care.
Yeah. Yeah, I think it's a complex issue. So what you're saying is that there's a medication which changes your pH and is causing chronic infections. That's very common. And it's, my understanding is it's not like the clinic doesn't care, right? But they have high volume and a lot of people, and they're answering the phones, and they got to pull up your chart. You probably don't see the same person every time, or maybe you do.
I try. The clinic it kind of makes you feel like they don't care. They just don't have very good reviews. They're just not. They want you in and out to get out of the way. So I've gone in there probably at least 15 times in 1 year, maybe more, with the same problem. Yeah. It's not like I don't voice it. Yeah.
So maybe it's time to switch providers. That's what I recommend. Is one other thing to mention too is so as midwives we do take insurance. So Medi-Cal is a really big one up here. Most of us don't take Medi-Cal, and that being, there's a lot of reasons for that. But what I want to say is, thinking outside the insurance paradigm, is that sometimes insurance won't cover the treatment or the care that you desire. And in those situations, it's totally okay and totally appropriate to look outside of what those options are. And for example, things like chiropractics didn't used to be covered, right? And now Medi-Cal is paying. For example, the clinic in Laytonville, Long Valley Health Center, has a couple chiropractors that are covered under Medi-Cal. So it's because of the demand and people wanting those services that those services are covered. The same even with midwives. So in the beginning, we weren't covered at all. Insurance started figuring out that it's actually cheaper for them to pay midwives. I mean, they still don't pay us fairly, but I just mentioned that because I hear this story a lot where people are dissatisfied with the health care that they have, but they feel stuck, and they feel like they have to keep seeking the same modalities and the same treatments. And so my suggestion is to also look outside of that and maybe explore the midwifery model of care and come see midwives. And that is something that we definitely can help with as well. So I just wanted to address that because I think as women we've been conditioned to put up with mediocre. And we've been conditioned to I've had so many people say well, I didn't really feel heard, or the doctor kind of just kept talking, telling me what to do, but I didn't feel like they were listening. We women have also been taught to continue to put up with things that are not okay and for too long. But I'm seeing that a lot of the younger generation are no longer okay with that. And they are much more likely to speak up. So in healthcare, what we can do is we can write things up. We can write complaints. Reviews are, that goes on the web page. But also if there is a particular issue, you could actually write it, and you could do what's called a grievance, or just actual documentation of what happened. You can also ask for things to be put in your chart. And that one's really, really helpful. So for example, be really informed. So let's say you're going to go to the same care provider, they're not hearing you, you need a different solution. Maybe this time you're going to say, I would like this to be documented in my chart that we had this conversation. I would like to say that I want other treatment options. I would like that documented. And most of the time, you get your needs met. It's also really helpful to kind of have an idea of what kind of treatment you might want, not always, but if, like, for example, that particular medication is causing an infection, are there other are there any other options? What happens if we try something else? Birth control itself has a lot of side effects, which includes, different issues like that. So sometimes exploring what other options there are. It's really, like, the healthcare we have really requires us to be our own advocates. And I think that's really exhausting for a lot of women who already do so much for everybody. A lot of people we take care of a lot of people. A lot of us, work, we have families, we have partners, we're in the community, we're volunteering. Who's at the PTA meetings? Who's running this organization? Not that it's all voluntary, but just saying that we are very involved. And often we, as women, put ourselves kind of last. And so that includes our health care. It's so amazing to me, too, as a midwife, how often I'll actually see clients who are like, I haven't seen a doctor or, come in for care in like 10 years, but now that I'm pregnant, this is the time. So it's often when we're thinking about other people that women will actually seek the care that they want. And so there's a lot of opportunities in healthcare to make those connections and make that situation better. Imagine if you had a provider that would even send you little texts and be like, how's that medication? Is it working better? Are you feeling better? That's the kind of stuff I'm able to do as an independent midwife, which I realize is, let's be honest, it is kind of luxury. I still think it's a really important aspect of our healthcare. And I work on many levels, so I'm not just providing physical care, but a lot of people come to midwives for emotional support. It's that one piece we're not really getting in our healthcare. It's very different. People come who are scared of going into a doctor or a hospital. Like, people get what's called lab coat syndrome, where they get, their heart will start beating, their blood pressure will go up, they can start to sweat. Some people will feel like they're going to pass out just by going to a clinical setting. So sometimes being seen in your home or in my office will be a little bit of a buffer, and you could still get a lot of your healthcare needs met that way. So it's cool because I'll do pap smears at people's houses, or they'll come see me in my office. Coming to you is really nice because most people feel most comfortable in their own environment. You can wear whatever you want. You don't have to wear one of those gowns. We just make it about you. And during that time, I want that to be of value. So make sure you have all your questions answered and any additional referrals or follow-up. So that's how we work. I mean, does it make sense that midwives can do more than just deliver babies? Okay, cool. And then questions.
As an older woman, I'm 30 years past my menopause, but as an older woman, I noticed that a lot of my peers are feeling even more self-conscious about their bodies, and male doctors and stuff, and I'll say, well, did you ask your doctor to do such and such? Well, no, I don't want to really, self-consciousness gets kind of excruciating. And so the thought of having a kinder type of care as you age was what appealed to me about what you've been talking about. Mm-hmm. And I wondered how that would manifest, what that would look like,
Yeah, it's something that we're exploring together in this time, because it is something I value highly. I always imagined from my own practice that as I got older, I would have more of that wisdom to offer myself, because I haven't gone through the change yet. But I have held space for women who have, and I think more than anything, women want to be heard and believed and not made to feel like something's wrong with us for having medical concerns. And so to actually say, it's not okay to go to a doctor or provider and to be ridiculed because of, your symptoms or your body. And I think a lot of women come away from healthcare feeling like they feel worse after the visit than better. What I like to provide is for you to actually feel like more inspired, more elated, more like joyful about doing changes in your life, instead of like managed or burdened or defeated. And I look for what's going well versus what's wrong. So like the premise is that most people already are doing their very best, and most people are coming because they care. And so I would always want to speak to people in that way, because I know that they're spending their resources and their time to see me, and so I want to make that time really valuable. And so that's maybe just for those things. I mean, I don't know exactly. I know healthcare changes, healthcare needs change, and I imagine as we get older, the needs are greater, depending on what the needs are. So what would you say what would you like to see in your providers?
Well, I'm very curious, and I'll ask, and I will fire a doctor if I'm not happy with them, but that's my personality. But I would love the midwifery energy, into my old age kind of thing. And I certainly don't get that with the AMA. I just had open heart surgery, I was, well, when I was giving that talk, it was kicking off right at that time. And the aftercare was horrible from the AMA part of it. The surgery was necessary, and I'm very grateful. But that was the end of the tenderness, when I got away from the original nurses in the hospital kind of thing, then I was just kind of, I'm slammed into my own, and what do I do, And I don't take drugs, so I didn't have that even for pain. And I felt like it was like, oh, well, you're allergic to morphine. Oh, well, okay, take Tylenol. And it was just,
Whoa.
after open heart surgery. So I felt really very uncared for a lot of months in recovery. So I reached out in my community, got lots of little dribs and drabs from wonderful, health care providers in my community that I've gone to for years. But it was all, my brain was weird. I was still, recovering from the surgical trauma of that. And there was just no basket. There was no nurturing basket for an older woman dealing with a severe trauma. Mm-hmm. And how do I get, climb back out of this painful, mentally disturbing space. So I did it, I'm here. But it was very, very hard. And the AMA part was, I got what I needed.
And when you say AMA, I guess
American Medical
advice?
Association, just
Okay.
American
Medical.
my generation has kind of straddled this for, all the years. So one puts in the expert doctor who's going to treat me perfectly and, has all the wisdom, and all my intuition that has drawn me towards herbal care and other things.
Mm-hmm. Yeah, and
when you need heart surgery, we want the best doctors. And there is this, I think what we're actually seeking is this blend between like the skilled, the surgeon who has the best skill set, but also the humanitarian side that also has like the how are you doing in the bedside manner. And I see how those two could work together. And maybe if that doctor doesn't have the people skills, he can surround himself on his or her team, right? To have those people that are more personable, that are like nurses that can check on you, call you at home to see how. There should be more follow-up. I mean, I think there's a lot of places that are missing. Childbirth is my area of expertise, but that is lacking in our culture. If you give birth in the hospital, you go home at 24 hours. A mother is not seen for sometimes up to 6 weeks postpartum. 24 hours to 6 weeks. This is why so many women die. I mean, imagine all the things that can happen. Of course, we see them way more often as home birth midwives. But that's the same thing where women are like, is this normal? Who do I talk to? And just to have, what if we even had social workers? What if we had, our healthcare could benefit from many layers, nurses that had better bedside manner, And then obviously doctors who are being trained as providers and nurses as well need to also bring their humanitarian side. We are no longer the elbow in room 33, okay? You don't want to be a body part in a waiting room. Like, we are whole human beings, and we deserve that kind of regard, whether it's that person's first surgery or their, thousandth. It's still that human being they're working with deserves that same regard. And so the same with when you are healing, you deserve that attention and that support without really getting it.
So what could I take back to other women my age and so on, as far as what services you could offer to maturing women?
That's so interesting. Well, midwives do work through the whole spectrum, and one aspect that I was really interested in is the later years, which actually Kitty Norris gave a talk a few months ago on end-of-life care, which was very fascinating, and it's something I want to learn more about. But we could maybe train, they don't have to be a certain age, they could even be younger, right? It's people that are attuned to help people transitioning medically. Because I see our needs in healthcare, they're not just medical, there's that human side that's missing. And what I hear is a lot of people aren't getting that, the follow through and the more hand holding. There's just like, here's your meds. And I'll share some of my stories. I ended up having my daughter in the hospital, even though I had planned a home birth, and she was born by cesarean. Well, like the next day, I'm like, still a little bit frazzled, I had planned a home birth, and I had the doctor, she's still practicing. She's a good doctor, but like I said, she could maybe use a little better bedside manner. I was like, I'm a little upset about my surgery. She's like, well, I'm not here to talk about that. I'm just here to take your staples out. So please save that for someone. And I'm like not even 24 hour, however many hours postpartum. So, and it's stuff we remember, and it's stuff, when you're in a fragile state, when you just gave birth, when you had an accident, when you have a near-death experience, when you go through anesthesia or go under surgery, you're in an altered state where you are way more vulnerable. And anybody in healthcare who interfaces with that really needs to step it up that way, because what we say, what we do can be remembered for the rest of that person's life. In fact, that's what PTSD is a lot of times. It's that loop of what could have, should have, what happened, and like trying to work it out. So I really hope that we can slow things down in our healthcare and really we really need to spend more time. It's not about seeing more patients an hour. You could see 13 patients an hour, but those patients are going to get about 3 to 4 minutes. Or you can spend, even 15 minutes is sometimes enough time to convey something, but we need to actually dedicate that time. So
you work with women going through menopause and postmenopause?
Postmenopause, most women who have completed going through menopause no longer need regular breast exams and regular pap smears, because by the time, because your hormones have shifted, so the risk of breast cancer and ovarian and cervical cancer goes down. But yes, I do, and I have seen.
And what would that look like with a menopausal or a postmenopausal woman? How do you interact?
Yeah, often they tell me what they're going through, and a lot of it is around different changes. So perimenopause women will be having different shifts within their skin and their flora, as well as dryness sometimes, as well as your libido changing. So we'll spend time talking about that. Once they've completed going through menopause, I see a lot of women with a lot more freedom, especially because they're like, yay, now I can't get pregnant, this is awesome. But sometimes there's the body image stuff, and I don't know if it's a generational thing or if it's I still don't know. I myself am very comfortable with my body, but I know the older generation, that's something I've noticed is a lot more modest. And so and it's okay, it's just something that I've seen more of. So even talking about sensitive things, it can be harder for them because it was taboo. It was taboo for so long to talk about our bodies that I think women that are older have a harder time articulating.
Well, I'll give you a specific example. Woman who was worried about spots on her skin and stuff. And she didn't really want to have her male dermatologist check her whole body, and she admitted that to me, and I said, I could look at your body and see what I saw. And she admitted that she was not doing that. He could look at something like on her leg or her arm or something, but she just didn't feel like it. And I said, well, let's find you a female dermatologist, And so we worked it out. But that's an example of that self-consciousness that can lead to some real difficulty with the melanoma or something.
Yeah, and that is also more common nowadays, the melanomas and the skin cancer. So it's good to get that checked out. That's something that, if she has a provider that specializes in that, it would be really pertinent. It's good that you were there for her to tell her to look elsewhere to find another provider.
I'm occupying a lot of the space here, but would Medicare cover your services?
Medi-Cal covers the lab work. Medicare, I haven't ever tried to bill, so I don't know.
65 and older.
Yeah, I wonder. That's something I'd have to research. I don't know, but they will only cover the lab work, not the provider fees. But still, we could still work something out, That's usually what I try to do with people, like, whether it's working with sliding scale or, figuring out something where payment is not the only option. And if, for example, for teen women, I will just do it for free, their appointment, just so they can get seen. So they're not, and especially if it's your first pap smear, it's such an honor to, do that for you. Let me just do it for free, So I don't know what else to say. And if obviously with elders, that's something to consider is, more limited income, fixed income. So then that's another layer to wrap our minds around,
Could you talk about the birth control options that you teach?
Well, I actually, so something unusual about me, I guess, is that I grew up learning that our bodies are normal. And from before I got my first cycle, my first menses, my mom taught me about fertility awareness. So I grew up just knowing that there's certain times when we are more likely to conceive and other times that we're not. So currently something like, I think almost 60-something% of high school age girls are on birth control, but only 40% are actually sexually active, because doctors are really happy to prescribe hormones. Hormones are very prescribed in our society. Some people have issues with them. I'm not going to go on and on about hormones, but if you are having symptoms, there's other methods. So fertility awareness looks at 3 facets, and I'll just share them really quick. This is not enough to use it as a method of preventing pregnancy, but it's enough to at least get you going. It looks at your basal body temperature, which is your temperature first thing in the morning. It's usually oral. It looks at your cervical fluid, and it looks at your cervical position, all those 3 things. And when studied as a system, it's 99% effective, so as good as most other birth control methods. I've used it almost exclusively for 24 years with only 1 planned pregnancy that was carried to term and no mishaps. And if you were to have a mishap, you would kind of know, because you would realize that you might have been fertile during that window. So it's really, the method itself, I should have brought the book. The best book on it is called Taking Charge of Your Fertility by Tony Wessler. Has anybody heard of it? That one is, it's all about how to study your fertility as a scientific method. So the reason I say it like that is because a lot of people are like, oh, it's the rhythm method, which the rhythm method is only based on your calendar. So you're like, okay, well, every 28 days I get my cycle. I must be ovulating around day 14, so I should abstain, day 10 through day 16 or whatever it is. That is faulty because our cycles shift. They shift with the moon, they shift when we have a new lover, they shift when we travel, they shift when we sleep or when we're stressed, when we're around other women, when we're around menstruating women, when we're around pregnant women. Too many facets. The calendar just can't do that. So this method is actually based on your own symptoms, not a calendar. Does anybody have questions about natural birth control or anything like that? And I can speak to all birth control too, so if you have questions about IUDs or tubal ligations or vasectomies or anything like that.
When you order lab work, where does the patient have that done?
Well, it depends on, she could either do it directly with me, so just come in and I'll draw your blood, or yeah, I'm trained in phlebotomy, or I can send her to either here Howard, here in Willits, or Adventist Health in Ukiah. I have another connection on the coast.
And you can do the full lab screening.
Whatever is needed. I mean, within the scope of women's health. Like, I'm not going to be doing cancer screenings unless they're like cervical or breast. You know what I mean? If that makes sense. And I can order ultrasounds, mostly obstetrical ones, but like if you needed one on a breast, like if there was a cyst or anything you need to explore like that, I could do that as well. Yeah, thank you for asking. I know there's such a wealth of knowledge. So thanks for coming. Please let your friends and family know that they can see midwives for women's health beyond pregnancy. And I'd love to keep collaborating with all of you. And thanks again, Suzanne.
Thank you.
Yeah.
Thank you very much.